Did you know?
Hi, and welcome to this week's episode of Did You Knows? This week we're going to be talking about tinnitus, or that ringing or buzzing sound that you can hear in your ears. So first, for a little background. So tinnitus is simply the sounds that we can hear that aren't actually produced from the world around us. Those sounds can sound anything like a buzz or a hum or white noise, or even it can sound like your heartbeat in your ear. We break these up into two different categories. There can be central tinnitus and then somatic tinnitus. The central tinnitus is the kind that comes from your brain. Possible causes can include hearing loss. We can also have growths inside of our head or different abnormalities with blood vessels. Any of these abnormalities would be investigated with special imaging and hearing testing that's available. Somatic tinnitus comes from our body, so that means outside of our brain. And so that can include anything, including your neck muscles, facial muscles, temporomandibular joints, or things within your spine. When we can identify that the tinnitus is somatic, it allows us to have a pathway for managing and possibly curing the tinnitus. One of the easy things that you can do yourself to identify whether your tinnitus is central or somatic are simple tests to activate muscles of your face and neck and see if there's any change or modulation to your tinnitus. Some examples would be to bite your teeth together. Clenching really, really hard activates the masseter and the temporalis muscle. If you find that that activates tinnitus or changes your tinnitus, it may be that you're activating those muscles too much, and then simply unwinding to figure out what can we do to calm those muscles down may allow for a reduction in your tinnitus or ultimately a cure. Other examples of things to try would be moving your jaw around. Forward, side, and see if that makes a change. You can also try shrugging your shoulders or have somebody push down on your shoulders as you shrug, or turning your head to the side against resistance. Turning your head to the side against resistance activates the opposite neck muscle called your sternocleidomastoid. And with that activation, we can then see turning to the left may activate and cause the tinnitus in the right to get louder. If you are identifying that these are some of the symptoms that you are suffering from, we should definitely see you for a visit where we can help to identify what things are going on in your upper airway, possibly in your sleep, possibly with your posture, possibly with your teeth, that could all be identified and possibly fixed to help with managing your tinnitus. Thanks for joining us this week on Did You Knows? We'll see you again next time. Follow us on Instagram, Facebook, and our YouTube channel. Take care.
Did you know?